my mother always taught me growing up, if you don't take care of yourself, who will? So our body always gives us signs, symptoms, when it's tired, when it's hungry, when it's thirsty, when it's stressed. So what I try to teach my ladies is the health of a family, it starts with the woman who takes care of that family. It really does. And so I think the first step is coming in and meeting with us, because then you find that it's a partnership. It's not a dictatorship. At this location, all the providers are women. We've all been through every walk of life. And so you have that comfort level where you're able to tell your story, it's a safe place, and then you partner with your providers in order to reach your own goal.
Hello everyone, welcome to another episode of Slice of Nirvana, and today I have with me Dr. Toni from Nabta Health. She is the medical director at Nabta Health. Dr. Toni, thank you for being here.
Thank you so much for having me, DT.
Tell us a little bit about Nabta Health for everyone to know what Nabta does.
Yes, so Nabta Health, it is a women's polyclinic. Our initial location is in Jumeirah 3, but it is a femtech company. So it started 6 years ago as an application with women's health education modules and products that are available all over the world.
Wow. So when you say it's a fintech company, you're operating, so for example, I'm sitting in Switzerland and I can actually join Nabta Health and be part of the whole journey with you?
Yes, you can make health goals, you can see your provider on telehealth, so you can reach us from all over the world.
So does it also gives, so for example, if I want to plan my wellness journey, I can plan it with you?
Yes, you can plan it through the app, and you can even see me online. You can exercise with our personal trainer online in the comfort of your home. So we've taken out all the barriers for a busy woman so that she's able to focus on her health.
That's beautiful.
Yeah.
How do you kind of educate women about this, and how can they start? So if there is a woman out there who has no time for herself and she wants to begin her health journey, so how can you help them do so?
I think first is taking away the stigma. And it's very mental. We're all busy. Whether you have kids or a busy career, life is so busy, especially here in the UAE. And so I think the first step is coming in and meeting with us, because then you find that it's a partnership. It's not a dictatorship. At this location, all the providers are women. We've all been through every walk of life. And so you have that comfort level where you're able to tell your story, it's a safe place, and then you partner with your providers in order to reach your own goal.
So it's a women's company only, like all the staff you're saying are women?
No, not all the staff
really.
are women.
Okay.
We gladly have male employees who rallied the cause. But as you said before, there's not enough attention or even funding that's given towards women's health.
Absolutely.
I would love to say initially, the UAE has a lot of women leaders here.
Absolutely.
On their boards, you know what I mean, in the government, and we're so proud of that.
Sitting right here.
We're so proud of that.
Yeah.
We're very proud of that.
Yeah.
So we're very privileged to be here. But yeah, there's a lot of work to be done. And as a mother, as a wife, as a doctor, I think I have 3 jobs, by the way, or maybe 4.
We all have.
No, it can be tough
Yeah.
to take care of yourself.
Absolutely.
But I'll tell you, my mother always taught me growing up, if you don't take care of yourself, who will? So what I try to teach my ladies is the health of a family, it starts with the woman who takes care of that family. It really does.
So what are these simple things that they can start with?
For their goals?
Yeah.
Once you come in and you meet with your specialist, actually you have a choice. So that's also refreshing. At Nabta, you get to choose which specialist you want to start with. We have psychology, we have dietitians, we have personal trainers, we have a midwife, family medicine specialist, physiotherapist. So it really starts with your current goals, because those change, right, through the seasons, as we age. So you meet with your specialist, you make an obtainable goal. So
Sure.
we definitely deal with expectations to make sure that you're going to be successful.
Absolutely. Okay. So you talked before about maintaining the balance.
Yes.
How can they bring in that balance, if they are just so busy that they have to take care of their health and rest,
Yeah.
at the same time maintain a work-life balance? Of course, we do little bit things here and there to find a synergy, but do you have any tips for them?
To find balance.
Yeah,
Well, number one, don't ignore your body.
sure.
So our body always gives us signs, symptoms when it's tired, when it's hungry, when it's thirsty, when it's stressed. And a lot of times when we ignore those signs because we keep going. So the first thing I would say is do not ignore your body. If it's giving you a sign or a signal, listen to it. Because what I've learned is if you don't listen to it, it will take what it needs eventually. It will
Sure.
take the sleep. The other thing is it takes a village. So looking at her resources, who's around her, is there a spouse? Is there a mother? Is there someone else who can also help? We're not meant to live this life alone. We're not meant to do it all by ourselves. And so asking for help, which I'm not that great at doing, I'm still working on it. I think that
But
also
that's
comes.
a great, that's a actually very important point.
Yes.
Asking for help.
Yes.
We often try to do everything by ourselves. We
Yeah.
think we can do it all. But do you think it's important to ask for help?
I do. I really, really do. Putting down our pride and really managing our time, our emotions, it takes everyone else who rallies around you. I call it your tribe. Your tribe are the people that you can trust to be there for you when things are good and when things are bad.
No, I think this is so important that you highlighted this point that you are finding it still hard
Yes.
to take help. Yeah, because even I'm the same, I find it difficult to ask for help at times when I
Yeah.
probably need it, when I'm really exhausted. It's just like, should I, or what, let me just do it all by myself.
Yes.
So I think like people like us, we are struggling with help. So I can only imagine what the others must be really feeling about asking for help.
Yes, and I always tell people it's good to find a provider that is willing to be vulnerable with
Yeah,
you.
sure.
I'm vulnerable with my patients. I don't hide my flaws. I tell them the things I'm still working on that aligns with what they're working on, because then it allows you as a patient to feel comfortable. Where I'm not perfect.
Yeah, you just said vulnerability now.
Yes,
Again, a
vulnerability.
very important word. How important it is to be vulnerable in your life in general?
I think it's key to be
Yeah.
vulnerable. I think when you're vulnerable, you learn more, you grow more, you're able to contribute to your community more, to the people around you. You're a better parent when you're vulnerable with your children. I think it just affects all areas of your life. It makes you a better person.
Absolutely, I agree. Mental health. Mental health is the key.
Yes.
Right now for, of course, with physical health, I think if we are mentally strong and healthy, the physical health kind of, flows
Yes.
in nicely and beautifully. So what's your take on that? Like when these women who come to you or the women who are listening to this, would you like to tell them how important is mental health and how they can work around it?
Yes, thank you. I think this is, number one, a great platform to reach women of all walks of life. Mental health is so important. Everything starts in our mind. Everything connects on the way down. And when one thing hurts, the other part of the body hurts. And so that's why we felt it's so important to have a psychologist. We have 2 on our team. Because the thought is, if you're having issues with your diet, or you're having a chronic medical illness, or even acute medical illness, those things are all intertwined with our mental health.
Sure.
If we don't take care of our mental health, then we're starting from ground zero. So I really want women to know that, there's no stigma in asking for help.
Yes.
No, we have all been there. We can share our own stories of postpartum depression, anxiety. That's why vulnerability is so important.
Absolutely.
because then you feel safe, and you have to start with your mental health.
Safety. Now, safety and security is such a key need, not just for women, any human from that perspective.
Yes.
For women, it's again kind of a stigma. I would say that, okay, you need to secure yourself, you need to be safe. But for all the single women out here, how can they get away with this feeling, or what can they do about it?
So when I think of safety, I don't necessarily think about physical safety. I'm thinking about emotional safety. You know, there's so many things mentally that can give us trauma. You know, there's gaslighting, there's manipulation, there's unhealthy relationships. Again, that's why parting with someone and being able to talk to someone who is not within your tribe, who doesn't judge you or your choices, is so important. But safety is not just physical.
So, at Nabta, if there is somebody who comes to you who's going through an abusive relationship,
Yes.
you can help them out?
Yes. So we have all the resources to refer them to the local authorities here that deal with domestic violence, safe houses, all those things we're equipped for.
Okay, this is a very important point because way back when I was going through emotional and physical abuse in my marriage before, I didn't know where to go to. I didn't know what to do. It was, my own space, and I was trying to fight it out.
Yes.
So, I think there's so many women out here who are not really aware that there is a provider or there are people whom you can reach out to when you're in this
Yes.
space. So I think this is really, really an important point. So if you guys are, going through abuse or of any sort, I think you should reach out, whether to a health provider or to people around you, right?
Yes, feeling like you can trust your primary care provider is so important because their job is to refer you to the right specialist.
How we can nurture leadership in the women who come to you at Nabta?
Yes, I think it's so important to nurture leadership in women. We need to see more women in the boardroom. And so one way we can do that is mentorship.
Sure.
So whatever job you do, if you take a woman under your wing, no matter how old she is, you're teaching her new skills. That's how we can nurture women, by giving them more knowledge, empowering them. If you are a woman who owns a business, hire women. If you're a man who owns a business, hire women. And equip them with skills. And then also give them better healthcare options. As Nabta, we are an adjunct to your insurance. So the things your insurance does not cover, we cover it. So it's beneficial for employers to actually buy memberships of Nabta for their female employees, because then they see higher productivity in their women. They see their women come back to work. They see them more
So Nabta is not just a health provider for women. I would say they also help in an overall development.
Yes.
We can say that.
Yes, definitely.
Perfect.
Because we're going to have other locations where we're not just seeing women.
And you also mentioned that they could still go on the app, join the programs,
Yes.
and get a taste of Nabta. Thank you so much, Doctor, for coming over today and talking to us about Nabta Health. I think it's a great platform, and women out there would love to join it, as it gives not just, they just not help you as a medical provider, but also helps your overall development. So it's really interesting to know, and we hope that a lot of women reach out to you when they need to be, and it's a platform which has an app as well. So if you cannot physically go, you can also log in online and reach out to Nabta Health. Thank you so much, Doctor.
Thank you so much for having me.
Any last words you would like to say?
I would love to say that we're here to partner with you. You can reach us on every social media platform, Instagram, Facebook, and if you're in town, come see us.
Thank you everyone for joining us today on Slice of Nirvana. A lot more episodes would be coming in soon. Stay tuned.